Italy is taking cautious steps into a new normal as the daily tally there has declined to the 5 digits from 6 last month. For more on the COVID-19 situation there, I have Dr. Michele Usuelli, who is also the Regional Council of Lombardy, live on the line. It's been a while, Dr. Usuelli, and it's a pleasure to speak with you again.
Thank you for having me.
Right, earlier this month, Dr. Usuelli, Italy lifted its outdoor mask mandate while keeping in place mask requirements for indoor settings. Do tell us a bit about the background behind this move.
Yes, we are mask-free outside unless it is not crowded. And the decision has been taken by our national government because of the epidemiological and scientific data allows it. The percentage of people in Italy who completed their vaccination schedule are nearly 83%. 49 million people, and people who just received one dose, but this is a good news because they are just recently convinced, are another 1.5 million people, 2.5% of the population. Only 5% of over 50, those who are at greater risk, never received the dose of vaccine. Children aged 5 to 11 received one dose in nearly 40% of the total population. And the risk of admission, now it is very clear in Italy, in intensive care or the risk of dying is more than 20 times higher in the no-vax population. We had our Omicron peak middle January. And from now on, for the third consecutive weeks, we are experiencing an important deflection of the new cases, 30% less every week. We assist to a constant reduction in intensive care as well as non-intensive care bed occupancy rate. And the daily average fatality rate in 1 week dropped from 350 to 300 in the last 15 days. So the situation looks better.
Right, that is good to know. Dr. Usuelli, now, despite efforts to ease social restrictions, I understand Italy is maintaining its tough stance against those who are unvaccinated. Having said that, how is this particular stance being regarded by the public there?
That is correct. Novax in Italy is a small, noisy community, but smaller and smaller. The two main right populist parties, Lega and Fratelli d'Italia, have been a lot indulgent with Novax community in the past. Now they do it more silently. Vaccination is not compulsory in Italy, but there are an increasing number of places where Novax people cannot enter anymore. In addition, and this is very strong message by our government, now unvaccinated people, more than 50 years old workers, they are put on unpaid leave. On the other hand, government has now put in place new rules at school level. Let's say, generally speaking, that if a student is vaccinated, when she or he is a contact of a positive case, he can continue to go to school. But if not vaccinated, the student must stay quarantined at home.
Right, I see. And staying with those vaccinated, Dr. Usuelli, what can you tell us about the Green Pass system over in Italy?
Yes. I support the Green Pass party, who doesn't exist, by the way. We could invent it. The Green Pass has been progressively implemented. In the beginning, you could get the Green Pass if immunized or healed since less than 5 months. Or with a negative test, you could get a 72 hours Green Pass. Then, learning from scientific data, we reduced the limit for the Green Pass to 4 months, not 5 anymore. But recently, government has decided that you cannot have a Green Pass just with a negative test. So there are scanners and mobile apps in our pubs, restaurants, museums, and public places. And just with a negative test, you cannot enter anymore.
Right, I see. Dr. Usueli, authorities in Italy have recommended a second booster shot, I understand. Initially, it was recommended for those who are immunocompromised, but according to our colleagues who are earlier on, the recommendation may also be extended to those adults, healthy adults, starting this autumn. Could you tell us a bit more about that?
Yeah, I also have seen, as you reported before, the article from the New York Times. But let me say that at present, the booster, we can call in Italy the fourth dose, the European Medicine Agency recommended just for those with deficit of the immune system. And considering that in Italy, many of them received the third dose more than 4 months ago, it's urgent now that the Italian Agency of Drugs and the Ministry of Health speak quickly about the fact that the third dose should be given to the people with immunodeficit. In the end, the decline of the fourth wave of COVID we have due to high vaccine coverage rate and spring is coming allow us to see the future with reasonable optimism. If new variants that are more severe or more contagious will not arrive. Knowing this, we have learned that it has its own seasonality, the virus. It's time now, we have few free months to plan for autumn, to study better for the autumn, and politicians have to learn how to foresee the planning. I am a bit worried because in next March 2023, there will be, as you are experiencing now, political elections. So we need to plan for this winter. But if it becomes too political, the game, then it can be dangerous if political parties dispute it.
Well, planning has to be a task for every country, I suppose. All right, Dr. Usueli, as always, thank you very much for making the time to join us live at this very early hour at your end with your thoughts.
Thank you very much. God bless you.